So this is regarding Saurabh Singh, who's a very nice gentleman who actually traveled all the way from Jaunpur, Uttar Pradesh to actually get his treatment for his stiff post-traumatic elbow with non-union of the bone. So actually he underwent a surgery in Oman after a crane accident in which he actually had an open compound wound of his elbow with a very complex fracture which was fixed in Oman. So when he presented to us, he actually had a stiff elbow with range of motion of hardly 10 to 20 degrees in the mid-range motion, and along with that he had other complications or issues that had to be resolved. So one was non-union of the fractures that were fixed previously. So there were plates inside the elbow, but the fracture was not united. There was loss of the radial head, which is the upper part of the forearm bone, which had actually happened when he met with an accident but was not treated in the primary surgery. He had a non-union of the elbow or the olecranon bone, and also non-union of the distal humerus or the lower part of the arm bone. Along with this, the skin condition all around the elbow was really bad, and at the same time he had a stiff elbow with movement of hardly 10 to 20 degrees. So after explaining all the details to him and he being a young guy, we decided to do this complex surgery, where our plan was to go in, remove all the hardware which was broken, and fix the non-union with fresh hardware and plates. Also bone grafted so that there would be union at the fracture side. I also replaced his radial head with a radial head replacement prosthesis. And of course, for the soft tissue, we tried to cover it as much as possible because there were plates underneath. But of course, as planned, he needed a flap surgery that was done by Dr. Shraddha very, very successfully. So now he's 2 months from the surgery, and he's already got about 30 to 120 degrees of range of motion. He's still working on physiotherapy, but I think this was a very successful surgery for him. And he'll be going back to Jaunpur, to his hometown, to continue his physiotherapy from here on. We will definitely be in touch with him telephonically, and I think he'll recover really well. So I wish him all the best for his recovery, and thank you for having trust in our team.
मेरा नाम सौरभ सिंह है, मेरा एज 24 है। मैं जौनपुर उत्तर प्रदेश का रहने वाला हूँ और मैं भुज में रहता हूँ अभी। और मैं ओमान गया था जॉब के लिए, तो मेरा वहाँ काम करते हुए मेरा एक्सीडेंट हुआ लेफ्ट एल्बो का। उसके बाद फिर मेरा वहाँ पे ट्रीटमेंट हुआ, बेसिक ट्रीटमेंट हुआ। उसके बाद फिर मैं वापस इंडिया आया। इंडिया आने के बाद फिर मैं अपना ऑपरेशन के लिए डॉक्टर को सर्च करा। जब फिर मुझे सर्च करते हुए गूगल और यूट्यूब के थ्रू मुझे डॉक्टर 𝗧𝗶𝗂𝗺 हॉस्पिटल मुंबई सेंट्रल का मुझे एड्रेस मिला। फिर मैं यहाँ आया, मैं इनसे कंसल्ट किया। इनसे बातचीत करने के बाद फिर उन्होंने मेरा एक्सरे और सीटी स्कैन लिया। सीटी स्कैन लेने के बाद फिर उन्होंने मुझे ऑपरेशन जो भी था उसमें प्रॉब्लम, उसके लिए ऑपरेशन के लिए सजेस्ट किया। उसके बाद फिर इन्होंने बहुत अच्छे तरीके से मेरा ऑपरेशन किया, और ऑपरेशन करने के बाद और फिर कुछ दिन बाद मेरा फ्लैप सर्जरी हुआ डॉक्टर श्रद्धा देशपांडे मैम 𝗂𝗏 हॉस्पिटल मुंबई सेंट्रल। उनका भी ऑपरेशन बहुत अच्छा रहा, बहुत सक्सेसफुल रहा, और अभी मेरा हाथ 90% रिकवरी हो गया है। मूवमेंट होता है, सब कुछ होता है। और यहाँ के जो स्टाफ हैं हाउस कीपिंग एंड और नर्सिंग, ये सब बहुत अच्छे तरीके से देखभाल करते हैं। बाकी मोहित सर और श्रद्धा मैडम का बहुत बहुत धन्यवाद, जो कि उन्होंने मेरा इतना अच्छा से ट्रीटमेंट किया। उसके लिए मैं उनको दिल से धन्यवाद करता हूँ।